Thank you for joining us. We're excited to be here and take this opportunity to talk about how GIS made a difference at Texas Children's. I'm Charles Summerhill.
And I'm Tricia Foster, and we are application architects at Texas Children's Hospital and Texas Children's Health Plan. Texas Children's Hospital is the largest children's hospital in the United States, and our main location is in Houston in the Texas Medical Center, which is the largest medical center in the world. Texas Children's Health Plan is a part of the Texas Children's Hospital family, and we provide CHIP and Medicaid health coverage to over 500,000 women and children throughout the eastern side of Texas. Our team utilizes ArcGIS Pro and publishes to our internal ArcGIS enterprise system. The maps that we deliver are almost exclusively web-based, frequently using Web App Builder and Insights. We also heavily utilize ArcGIS sites as a directory for maps for our customers and to display dynamic information regarding our population. We also make use of the ArcGIS Advantage program for assistance with upgrades, consulting, and training. Some of our major projects we have worked on include network adequacy mapping, our mission control project, emergency management, and centralized scheduling. Our TDI, or Texas Department of Insurance mapping project, was one of our early projects in which we use Python automation to import providers and generate over 1,000 PDF maps within a few hours for submission to the state. Our first big web application was our mission control project. Our member services and care coordination departments utilize this application to locate providers and other resources near a member's current location. It also includes bus stops and routes to assist members that have transportation challenges. Our emergency management project has unfortunately been very heavily utilized for the past couple of years. We have used it for hurricanes, tornadoes, floods, the recent big winter freeze, plant explosions, and a Houston city-wide water outage. The web map application pulls in live weather information from the Living Atlas, allowing us to see members who may be in the path of a storm or other affected area. It also allows us to add points or polygons on the map to indicate affected areas and determine how many members are impacted with just a few clicks of the mouse. This data is then used for both automated calls to affected members and manual calls to those with higher risk health conditions. This app allows us to help our members stay healthier and prevent trips to the emergency room by allowing us to reach out to those members and help them obtain resources. People in the middle of a disaster don't expect their health insurance provider to call them up offering assistance and making sure they have what they need. People may not expect that, but I promise you they are pleasantly surprised and grateful to hear from us. We also created a centralized scheduling application which allows our schedulers to determine drive distance and drive time to a member's home, while keeping the home address of our employees completely confidential. This particular application has a web front end and uses the ArcGIS tools on the back end for calculations without actually displaying a map or an employee address. It also integrates with a non-GIS application to help with scheduling care coordinators. We have a number of scheduled processes to automate refreshing member, provider, security, and other data so that our maps and applications always reflect the most current information. We are working on automating network adequacy maps, which will allow us to always know what our coverage looks like. It will allow us to be more proactive in targeting and recruiting new providers to our network and visualize how adding a new provider can impact coverage. We are also working on a PCP assignment project, which pulls a member's prior claim activity and patient preferences from our Epic system and uses that with driving time calculations to automatically select a primary care provider for members who have not selected one. We also use GIS for determining site suitability, generating territories, vaccine distribution, and when COVID had just started, some of our leaders even used it for helping determine routes for them to personally deliver care packages to their employees. But these are just a few examples of how we use GIS at Texas Children's. When someone requests a map, we love to ask them to give us an overview of their project so we can come up with things that may be helpful and often just add an extra layer or widget to the map that we think may help. We also like to encourage people to tell us how they would finish a sentence that starts with, "Wouldn't it be cool if?" I can't tell you how many fascinating projects and enhancements have started with that very phrase. ArcGIS is so much more powerful than just displaying points on a map and giving directions, and is crucial to make sure that others in your organization realize that. GIS is helping patients and members at Texas Children's every day, and we can't wait to see how it continues to improve their health in the future. Thank you.